Okay, you're live.
Hey guys, Matthew here. We're at Dr. Jason Emer's office, and we're with our post-op patient. She's 1 day post-op, and she had an incredible result just 1 day post-operatively. Dr. Emer wanted to kind of give her that Emer hourglass shape that we like to call it, where he actually took out fat from her torso, so she had high definition liposuction done to her torso and also her legs here. And what he did was he actually contoured the leg, redistributed the fat, because as we could see before, we have some maldistribution of the fat, giving that saddleback look, and we actually redistribute the fat upward to the buttock to kind of give that hourglass figure. So we can see now she's getting this lymphatic massage to kind of help get the excess fluid out. Adam here is, why don't you tell us a little bit about what you're doing?
So basically, we are moving all of the excess lymphatic fluid, blood, any leftover anesthesia from the procedure out into the drains to allow the skin to lay flat against her muscles and look nice, tight, and beautiful.
Exactly. So now also with this patient, we did a tummy tuck in the front. So we did a little mini tummy tuck, and that helped reduce the amount of skin and kind of give that tighter look. And this line here, I know it's under bandages, it looks all bloody now, but after she's healed, it's going to be very, very hard to notice. It's going to be like a hairline scar that, if done right, will actually heal to very close to her skin tone. So the lymphatics are going to help heal faster. It's going to get rid of that excess volume that's inside of her right now. We have her IV drips because Dr. Emer did take a lot out, but wanted to stay on the safe side. But look at the result that we can see her shape right now. Even if she's swollen at 1 day post-op, the results are just phenomenal. We can already see the difference in her shape here. If you come on close, you can actually see now she has that contour. It's that shape everybody wants. And we redistributed the fat from here, and Dr. Emer injected it up into the buttock. And obviously liposuction in the abdomen, along with J plasma for skin tightening and contoured. I mean, look at the contouring here, even in the middle and on the sides. I mean, this is just 1 day post-op, guys. It's only going to get better from here. She can also do radiofrequency treatments, which are going to help dissolve even more fat if there's any left, and then actually tighten that skin a little bit more. Because when we reach that temperature that we want with radiofrequency treatments, if you tuned in, you know it tightens that area even more.
Can you combine this with hyperbaric or IV therapy?
Yes, so the IV therapy she's actually getting while she's massaging, getting massaged rather, and the hyperbaric is done to also help hyperoxygenate those tissues, as we've also discussed before. It's going to help reduce bruising. I mean, she has minimal bruising now, even 1 day post-op, but a lot of patients have, a lot of bruising, depending on how aggressive the treatment was, the surgery. It helps reduce that, and also helps with inflammation and reducing that downtime.
What does that downtime look like?
Well, definitely depends on your surgery, but results can take up to 6 months, even a year, just depending on that swelling. But a lot of other offices don't do this post-op care, which actually reduces that down by a lot. You can be up and exercising in a matter of month or two, but we can see these results. She's going to heal from this scarring, and no one's going to barely even notice she had anything done. And all these lipo entry points for the devices, that's going to close up. It's not even going to be noticeable. And we have these drains here to actually be a pathway exit point for the drainage to leave our patient's body.
Fancy says, wow, she looks amazing.
Yes, she does. And again, this is just 1 day post-op, so guys, it's only going to get better from here. But that's pretty much it. She's going to heal, and she's going to repeat this daily until she's ready to heal on her own at home.
Para's worried about the scarring.
So scarring now is not like back in the day. We have finer techniques. Dr. Emer definitely employs the best techniques to actually sew the patient, and our techniques actually allow, with postoperative care, especially with the hyperoxygenation chamber, the hyperbaric chamber, you're going to hyperoxygenate those tissues so that they're healthier and they're closing faster. Because when you have delayed wound healing, that's when scarring can actually be thicker and hypertrophic and be above the skin. We want it to stay as flat as possible and heal naturally and quickly. So with that combination treatments, you can even get lasers done to definitely eliminate the visibility of the scar.
All right.
All right. Well, thank you guys for tuning in, and we'll see you next time with another patient pretty soon, I'm sure. Thanks, guys.
Thank you.
How long is that?